Hi, my name's Phil. I like to talk about politics, and in this video I'd like to consider Boris Johnson's stated assessment of how the rate of coronavirus infections will go this year, linked with the additional pressures on the NHS that he has inflicted with his poor handling of equipment procurement. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So for the second time today, I will just point out that yes, in case you hadn't watched the earlier video today, new camera, nice new camera, but also different microphone, which is not really intended like the old microphone, but the old microphone won't work with this camera. So just let me know how it's appearing. But anyway, going back a year now, and the coronavirus pandemic was sweeping through Europe, and the initial bullishness of Boris Johnson, who boasted about shaking hands with COVID patients and how we should all just take it on the chin, had abated as we were in our first lockdown, and Johnson himself had only been discharged from hospital a few days earlier, having been seriously ill with the disease. The NHS was struggling with not only the increasing number of patients, but a lack of equipment. PPE shortages were severe. In the continent, however, Germany had the capacity to deal with its own emergency and also help people out from other countries as well. This is because Germany's healthcare system had extra capacity built in specifically to deal with these emergencies. In other words, in normal times, they have capacity in their system that's just not been used. Conservatives would look at that as wasteful. Well, you're not using that stuff. Yeah, we are every now and then now. In the UK, after 10 years of Conservative rule, that meant that we didn't even have the capacity to cope with normal seasonal winter surges in demand. Just the winter before, there were hospitals full to bursting, patients left lying in corridors, and still the government managed to win a general election. But in a healthcare service that had been undermined for a decade to the point whereby we couldn't even cope with normal winter demand, we had no chance against such a virulent global pandemic. We set up the Nightingale hospitals, fantastic feat of engineering really, extra beds for the increase in patients, but it was all a PR stunt, because we didn't even have the doctors and nurses to staff our existing beds in hospitals, let alone new temporary ones. We are tens of thousands of nurses and doctors short in the NHS. That was the case before the pandemic. But the thing is, behind the official figures, the shortage is now actually much worse. You'd argue it looks better, but it's worse. Because at any one time, any sector of our economy will have staff off with an illness or injury. Now that's expected. And if it stays reasonably consistent and predictable, then staffing levels are maintained to cope. But we've made the situation inconsistent and unpredictable in the NHS. Because the government didn't give the NHS the PPE it needed, lots of NHS staff came into contact with the virus. I mean, hospitals and clinics were, as you'd expect, absolute vectors for the disease during lockdowns. Because in a lockdown, a lot of places where people would naturally congregate indoors may have been largely deserted. In fact, most would have been. Hospitals aren't one of them. Sure, they have different procedures in now, but at the same time, there's still lots of people there. Staff were infected en masse due to a lack of suitable PPE, some of whom, of course, died, but many more of whom are now suffering the effects of long COVID. Even now, the NHS is still short of 36,000 nurses. Now, this is better than when Boris Johnson took over as Prime Minister. He talks about how he has reduced the shortage. Absolutely true, it has been reduced. But only by a small amount. We are still 36,000 short. And that's 36,000 short of the figure that the Conservatives think we need, to not be able to cope with those winter demands. And a recent report highlighted the fact that at least 122,000 NHS staff, which includes more than just nurses, that's all NHS staff, have long COVID as a result of becoming infected. The same report showed that there are 114,000 teachers with the same condition as well. Another profession that was not kept safe during the pandemic by the government, which means that the NHS and teaching staff account for a quarter of the total numbers believed to be suffering from long COVID in the UK. But the point is that this means the NHS workforce has effectively been weakened, severely weakened. The members of staff, the number of them is down on where it needs to be. But it also looks like it's improving because you can look at, how many staff are employed there. It looks like it's getting better. But if lots of the existing staff that are officially on the books are too ill to actually work effectively, if they can work at all, then the real strength of the healthcare workforce is weighed down. And it'll take years before we understand the full effects of long COVID. But right now, we know that it can mean people are unable to work at all due to physical impairment or pain. It's also been responsible for hitting people's intelligence. In England alone, there are 30,000 illnesses in the NHS linked directly to COVID. That is a huge additional factor on the already worrying shortages of staff. And this is where I want to come back to that comparison between the UK and Germany. So where the UK had a shortage of capacity for even normal times, and Germany had expanded capacity that simply wasn't used most of the time, because Boris Johnson puts us into lockdown restrictions, it's never a short, sharp shock to suppress the spread of the virus for a short time, because it's always when the NHS is just about to be overwhelmed. And that means it lasts for weeks or months at a time. And the level at which the NHS is about to be overwhelmed is directly linked to the capacity in the NHS. So last year, for the first lockdown, our capacity was too low after a decade of Tory abuse. But now, thanks to that same decade of abuse, but also the impact of long COVID on NHS staff, that capacity is now even lower. That means that our threshold for coping is significantly lower than it was, which means that with each new surge, it doesn't now need to be as high before it overwhelms the NHS. It means that non-urgent treatments, such as for people with nonetheless serious illnesses like cancer, is delayed again. And the thing about long COVID is that the name is designed to fit the issue. It's for the long term. Even if we start to get the pandemic under control, which remains to be seen, because they say this every time, don't they, as we come to the end of restrictions. This is it now, we're not going back into them. You said that 3 times already, haven't you? Remains to be seen. But if it is, and we reduce the number of NHS staff who are coming into contact with the virus, well, those who've already been affected, which is in excess of 100,000, are going to continue to suffer from the effects. And remember, at any one time, 30,000 are off work with it. And the rest presumably are not working at full capacity. And we may have this for years to come. And combined with the shortages that already existed and were, coming down, but very slowly, which are not being reduced very quickly at all, this means that our capacity is going to remain far too low for far too long. And that's without even considering the fact that the NHS, that Tory abuse of the NHS is still continuing. It's being sold off right now anyway. The process of privatisation has been going on for a long time, but it was little by little. But the rate has massively accelerated in the last year. So even when the pandemic abates, and hoping we don't get another one to mug us a few years later, the NHS is still going to be dealing with a huge backlog of the usual major illnesses in the UK, heart disease, lung disease, cancer, liver disease, and so on. In addition, it's going to be having 1 million long COVID sufferers in the UK on top of that. And remember, we already didn't have the capacity to deal with the usual stuff before. Now we have a backlog and a brand new illness affecting over 1 million people. And just to add insult to injury, many of those long COVID sufferers are NHS staff. We don't even have as many personnel to cope with the extra workload. And all of this because the government refused to buy in PPE for the NHS. And don't buy into the rubbish about high demand around the world. It was very difficult. The government were told to stockpile quite a lot of the PPE we needed in 2019 as part of our normal emergency planning, before we knew what that emergency would be. The government refused. There's no point in spending money. We'll wait till we need it. They were told in February 2020, we need it. It's looking bad. We need it. No. They were told again when it hit our shores. PPE producers in the UK said that they were fulfilling contracts for other countries, but if they got NHS contracts, they'd prioritise them. The government didn't give them those contracts. Instead, they saw an opportunity to scam the country, shoveling billions of pounds to friends and donors who rushed to set up new made-up companies pretending to be PPE suppliers to benefit from the Tory gold rush. What we got was either nothing far too often or not what was ordered. It took a long time for the NHS to actually get the PPE it needed, by which point a large proportion of the workforce was infected. Over half of all the staff in the NHS now have long COVID. Frankly, the fact that people are largely unaware of the serious ramifications of the Conservatives' mismanagement of this serious healthcare emergency is a national tragedy. But there we are. Those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.